take a look at your movement. I can see respirations. I don't see any palpations or peristaltic waves, which is completely normal. You can't really see that in people. So next, I'm going to take a look at your contour. You look like you have a flat shape, and your stomach contour is symmetrical, which is good. Next, I'm going to take a look at your skin. You look like you have a nice light pink color. I don't see any abnormalities, just a couple of moles, which is completely normal. And next, I'm going to check your umbilicus, which is your belly button. And it appears to be midline vertically and horizontally. It is inverted, and I don't see any abnormalities there or any umbilical herniations. Next, I'm going to take a look at your muscles. So if you could just pick up your head for me. All right, I'm going to check your rectus, your inguinal, and your femoral, and I don't see any herniations there, which is good. Next, I'm going to auscultate your stomach just to listen to your sounds. So I'm going to start in the right lower quadrant. All right, so I heard about 7 bowel sounds in a minute. I heard the gurgling sounds, and they were high pitched, which is completely normal, and I didn't hear any abnormalities there. Next, I'm going to take a listen for bruits, and I'm just going to check your aortic, your renal, your iliac, and your femoral. I'm going to come this way to check your femoral. All right, and I didn't hear anything there, so that is completely normal, no abnormalities. Next, I am going to percuss your stomach. Just listen to what it sounds like. All right, so I don't hear any abnormalities there. I hear tympanic sounds over the air and dull sounds over your organs, which is completely normal. Next, I'm just going to percuss your gastric air bubble right along this midline. And that sounds hollow all the way across, which is normal. Next, I'm going to percuss your spleen. So I'm just gonna walk my fingers down to your 9th through 11th intercostal space. And I hear a dull sound over your spleen, which is completely normal. Next, I'm going to palpate. So I'm gonna start with light palpation. So just let me know if you feel any tenderness. Any tenderness in the lower right quadrant? Any tenderness in the upper right quadrant? Any tenderness in the upper left quadrant?
No.
Any tenderness in the lower left quadrant?
No.
Okay, so I forgot to percuss your liver. So I'm going to go back and do that right quick. Luckily, I haven't done any deep palpation, so hopefully we can still hear everything. So I'm going to start at your 5th intercostal space and work my way down. Alrighty. And then I'm going to work my way up from the bottom. All right, so the diameter of your liver is about 6 centimeters, which is completely normal because the mean diameter is 6 to 12 centimeters. So to continue on with my palpations, I'm going to now do deep palpations. With your light palpations, you didn't have any tenderness, and I didn't feel any, starts with an M, give me a second. Masses. Okay, so now I'm going to deep palpate. So I'm just going to do a dipping motion. Any tenderness there? Any tenderness there? Any tenderness there? Any tenderness there? All right, so no tenderness, didn't feel any masses, no abnormalities there. So next I'm going to palpate your spleen. So if you could take a big deep breath in for me. All right, and I can't feel your spleen, which is good. That means it's not enlarged. Did you feel any pain there? All right, so next I'm just going to check your right kidney. So if you could take a big deep breath in for me. All right, do you feel any pain there? All right, I can't feel your right kidney, which is completely normal. Take another big deep breath in for me. All right, any pain there? All right, I couldn't feel your left kidney, which is completely normal again. So take one more deep breath for me. I'm gonna check your liver. Any pain there? All right.
I'm just gonna make sure I don't see any major lumps or bumps, which I don't. Not seeing anything out of the ordinary. Have you had any stomach pains lately at all?
No.
Okay. When was your last bowel movement?
Yesterday.
Did it go okay? Is
Yep.
everything okay? When was your last menstrual cycle?
About 3 weeks ago.
3 weeks ago? Was that normal?
Yes.
Okay. And do you have any pain with like urination or anything? No. Okay. So I checked your stomach out. I'm gonna have you first. It's only gonna be for a couple seconds. If you could hold your breath and lift your head up for a second.
Okay.
I'm just gonna make sure I don't see any major hernias.
Okay.
Okay. I don't see anything out of the ordinary. I'm not seeing any major bulges or anything. So you can relax, you can breathe.
Okay.
So before I feel around, I'm gonna take a couple listens.
Okay.
I'm just seeing if anything in your bowels sounds weird.
Okay.
Let me know if any of this hurts or is tender while I'm doing it.
Okay.
Your tummy is very active. I can hear it. Awesome. So I listened to all your bowel sounds. They sounded good. I heard all the correct gurgling and stuff that I'm supposed to. I'm going to go ahead and listen to some vascular sounds with the other side of my stethoscope.
Okay.
All of those sound really normal. I don't hear anything other than the normal swoosh I'm supposed to.
Okay.
So I'm gonna feel around for your aorta now. Just making sure. Okay. I feel it. I feel the pulsation. Does this hurt when I do this?
No.
Okay, perfect. So now what I'm gonna do is I'm gonna feel around lightly at first. All I'm feeling for is superficial masses and stuff. I am then gonna go in deeper. I'm feeling for lower, more organal masses. So you just let me know if any of this, it hurts at any time.
Okay.
Nothing?
Nope.
Okay, I'm gonna go in a little deeper, just feeling for those deeper masses.
Okay.
Okay, I didn't feel anything. I'm gonna feel around your belly button. I'm feeling your umbilicus, and that feels very firm.
Here it is flat. There's no lesions, masses, or rashes noted. The skin is pink, warm, dry, and intact, and smooth. I'm going to percuss your belly. Okay, and it is tympany and resonance, tympany and dullness in some areas. I'm going to listen to your vowel sounds. Okay, and they are all present. I'm going to listen to your arteries. This is the aortic, the renal, iliac, and femoral. Okay, no bruise heard. Alright, I'm going to palpate. Start with light palpation. Any tenderness? Okay, deep palpation. Any tenderness? Okay, taking a deep breath, I'm going to palpate your liver. Okay, you can exhale. Any tenderness? Okay, I'm going to palpate your spleen. Taking a deep breath. Okay.
Can I have you go ahead and lift up your shirt a little bit? Good, that works. I'm gonna get eye level and expect. All right, no distension and no pulsations were noted. I'm gonna go ahead and osculate to one quadrant of your stomach for 1 minute to determine the bowel sounds. Listen to your bowel sounds. All right. Okay, good. I heard 10 gurgles, so normal active bowel sounds. I'm now going to percuss around in a circle. Okay, good. Tiffany was heard all around.
I'm now going to palpate, starting lightly and then going deeper. Okay, good. Any tenderness there when I did that?
Nope.
Okay, I didn't palpate any lumps or enlarged organs, so no organ myography. The bladder was non-palpable.
Symmetry, and she does have contour and symmetry. Her belly is flat and symmetrical. I'm going to begin by listening to bowel sounds in all 4 quadrants. I will start in the left lower quadrant. Perfect. Bowel sounds are normal, active in all 4 quadrants. Next, I will go ahead and listen for any bruits in her aortic valve, her right renal, left renal, and then both bilateral iliac arteries. So first, I will start with her the aorta, and I will go ahead and find the xiphoid process midline. Okay. And there is no bruit noted. Next, I will go ahead to the lateral left renal artery above the umbilicus, lateral right renal artery above the umbilicus, lateral right iliac artery below the umbilicus, lateral left iliac artery below the umbilicus. And I do not hear any bruits. Next, I will go ahead and percuss for tympany, for flatness and dullness and tenderness in all 4 quadrants. And there is no flatness, dullness, or tenderness when I do tympany. Next, I will go ahead and palpate for any masses or tenderness. Let me know if you feel any tenderness. And I do not feel any masses. Did you feel any tenderness? And she did not feel any tenderness. Next, I will go ahead and do the Blueberg sign. And this will, I will take my hand at 90 degrees and I will go on in, push down, go up. Did you feel any tenderness? She did not feel any tenderness, so it is a negative Bloomberg sign. Next, I will go ahead and palpate for her liver. I will take my left hand and put it under her back here. And then I will take my right hand at her costal vertebral space. And I will go ahead and take a big deep breath for me. Push in. Perfect. And I do not feel her liver, which is normal. Next, I will go ahead and palpate her spleen. Go ahead and turn towards me. I will put my hand towards her back here, and then I will take my other hand at her costal vertebral space. Go ahead and take a big deep breath. Perfect. And I did not feel her spleen, which is normal. Thank you very much. Doing okay?
Assessment, okay? And as with any assessment, this starts with inspection. So I'm just inspecting his abdomen. It looks nice and flat. I don't see any protrusions or distension, no ascites, and no obvious masses or hernias. The next thing I'm gonna do is auscultate. I'm gonna listen for bowel sounds in all 4 quadrants, and then I'm gonna auscultate for bruits and the various arteries within the abdomen. So I'll listen to bowel sounds with the diaphragm on my stethoscope, and I'll start in the right lower quadrant and move in a clockwise direction. Great. Bowel sounds are normoactive to all quadrants. If I did not hear any bowel sounds, I would have to listen for at least 5 minutes to confirm that finding. Next, I'll listen for bruits, first in the abdominal aorta. So I'm gonna listen with the bell of my stethoscope because it picks up our lower pitched sounds. So I'll listen between the xiphoid process and his umbilicus. I can actually see a little pulse from his abdominal aorta, so I'll listen for any bruits here. And I don't hear any. And then right above his umbilicus, about 2 centimeters to either side will be his renal arteries. I'll listen for bruits there. And the other side. And then below the umbilicus, 2 centimeters on either side, we'll listen for the iliac arteries. And then we'll listen at his femoral arteries. And I did not hear any bruits. All right, next we're gonna move on to percussion of the abdomen. So I'm gonna percuss all over throughout all 4 quadrants. I'm listening again for tympany or areas of dullness. I would expect to hear dullness over the liver and tympany everywhere else. Okay, so we'll percuss. I'm hearing tympany. And there's my dullness over the liver. Are you doing okay? Mm-hmm. Okay. Next, we'll move on to light palpation. I want you to tell me if you feel any tenderness, okay?
Okay.
Okay. Any tenderness?
No.
Okay. Feeling for any masses or anything like that, which I did not feel. So next we'll go ahead and I'm gonna palpate your liver, Kelly. So what I'm gonna do is I'm gonna look for the end of his ribs here, and I'm actually gonna try to cup my hands around his ribs as he takes a deep breath in and try to palpate the liver edge, okay? So I'm gonna find his ribs here and then hook my hands kind of underneath, and I'll have you take a deep breath in and out. Great. And it's slightly palpable, just the edge. Okay, I'll have you sit up and actually turn around so I can palpate your spleen. Now the spleen is not normally palpable. So what I'll do is I'm gonna have you put this arm above your head. And then again, I'm finding where his ribs end here and putting one hand here and one hand beneath him. So I'm gonna try to, as he takes a deep breath, bring these hands together and see if I can capture the spleen. So I'll have you take a breath out and now breathe in. All right, I did not palpate a spleen, which tells.
And then from there, we are gonna move on to the abdominal assessment. So I'm gonna have you lay all the way flat. And I'm actually gonna lift up your, all right, so we are going to first start by inspecting the abdomen. I'm looking for any redness. I don't see any redness here. No redness around the umbilicus or any herniation. I don't see any obvious peristalsis or pulsations, and the contour is flat. So the next thing we're gonna do is auscultate. So I'm gonna auscultate in all 4 quadrants. She has normal active bowel sounds in all 4 quadrants, and then we would switch to the bell. We're gonna auscultate the renal, iliac, and femoral arteries, listening for any bruits, excuse me. The femoral area. I don't hear any bruits there. So the next thing we're gonna do is percuss. I'm gonna percuss the abdomen in all 4 quadrants. I hear tympany throughout. The next thing we're gonna do is percuss for liver span. So basically what I'm gonna do is percuss down from the mid-clavicular line until the sound changes to dull, and then I'm going to continue percussing down until the sound changes back to tympanic. It's usually about 4 to 8 centimeters for a normal liver span. Next thing we're gonna do is palpation. We are going to palpate first, doing light palpation, Just feeling for any masses. Do you feel any tenderness? There's no tenderness there. Then we're gonna do deep palpation. I am attempting to palpate the liver, the aorta, the spleen, and the kidneys on both sides. All of those are non-palpable, which is a normal.
Okay, so first I'm going to begin with a visual inspection. I'm going to be looking for any tattoos, moles, hair patterns, skin discolorations. I'm also going to be looking to see if I can see any visual masses or pulsations. Good. Next I'm going to move on to auscultation. So first I'm going to use the diaphragm of the stethoscope. And I'm going to listen in each quadrant for 15 seconds. So there I was listening for any bruits or weird abdominal sounds. Next I'm going to switch to the bell, and I'm just going to be listening to her aorta, the liver, the spleen, the iliac, and the femoral artery. I'm just going to flip your pants a little bit. Okay, so again, I'd be listening to any bruits or weird abdominal sounds. Next, I'm going to move into palpation. So first, I'm just going to start with just a superficial palpation of the abdomen. And I'm just going to let my patient know to tell me if she has any pain, okay? Next, I'm going to move a bit more deep. So I'm just going to kind of use a wave pattern with my palpation. Okay, now I'm going to palpate the liver. So I'm going to find the bottom of the ribs, have my patient take a deep breath in and let it out. Just feeling for the liver, and now I'm going to palpate around the liver. Next, I'm going to palpate the abdominal aorta, so I'm just going to use a kind of a V-like contact to feel either side of it. Okay, now I'm going to feel the spleen, but in most patients that it should not be palpable. Okay, next I'm going to move into percussion. So I'm just going to start by palpating along the xiphoid to the umbilicus. Now I'm going to go mid-clavicular on the right and mid-clavicular on the left. Now I'm going to do the borders of the liver. And the spleen. now I'm going to do some special tests. So first I'm going to feel halfway between the ASIS and the umbilicus for McBurney's point, and I'm just going to press in, and my patient will let me know if they have any pain. If she did, that may indicate appendicitis. Then I'm going to do the rebound test, so I'm going to push in really hard on this side and then let it go. And if she had any referred pain to the right, that would also indicate